Aloha. I want to thank you for being here and for joining us today. So grateful to have you here. My name is Dr. Catherine Taketa-Wong, and today we're going to be talking a whole bunch actually about, um, we're going to be talking a lot about autism, and we're going to go through a lot of different things. But again, I just want to thank you for joining me. For those of you who aren't familiar with me, my name is Dr. Catherine Taketa-Wong. I'm a naturopathic physician and acupuncturist. And for those of you who aren't familiar with naturopathic physicians, like medical doctors, we have to attend a 4-year medical school. We also are trained as primary care physicians, and as such, I can order lab tests, write prescriptions, and do school physicals just like other doctors. However, a big difference is that we are trained in the power of nutrition in terms of building health from the inside. So, again, just one of the things that I definitely want to go over is that we're going to be talking about some of our differences in the approach with autism. And there's a big difference in terms of naturopathic physicians, how we're trained. So, with naturopathic physicians, we are trained in the power of nutrition to build health from the inside. I use personalized food recommendations, vitamins, herbs, and other types of natural medicines to address the underlying causes of disease and treat the whole person. But there's more. There's more to you than just your ailments. You have feelings. Um, you also have emotions. You have concerns, moments of victory, and moments of relief. And so, as a naturopathic doctor, I treat the whole person. And that's really a big difference in terms of the way that I treat autism. Because again, it's really about treating, again, the whole person and really treating the underlying causes and not just treating the symptoms. So, and we'll be going through some of those things in a lot of detail with that. Um, so, I also have a master's degree in Oriental medicine, which allows me to include Chinese medicine and acupuncture in my treatment protocols. So before we begin, if you have any health concerns that you would like to talk with me about, we offer a no-charge phone consultation called the Personal Health Strategy Session. So this is a 15-minute strategy session where we can talk together about your health concerns, and I can develop a plan to see how I can help you the most. Arranging a consultation is very easy. Just call our office at 808-425-2987, or you can text free consult to that number. You can also click on the contact button on our Facebook page, and either way, our staff will contact you to arrange a no charge phone consultation. And you'll also find all of our contact information right here on our Facebook page. So let's get started with today's event. And today we're talking about how the proper form of folate, which is vitamin B9, can lower a baby's autism risk in the womb and may actually reverse it in some children up to age 4. So please feel free also to use the comment section to ask questions as the talk progresses. Because autism can be such a devastating diagnosis for new parents, and raising a child with autism presents so many challenges, it seems too good to be true. But scientific studies have reinforced this finding. Folate or vitamin B9 can work wonders in both reducing an unborn baby's risk of autism as well as reversing it in some children around age 4 and under. Just to go on, after thinking about that, the key, for this is really having the right form of the vitamin, because otherwise it may not help. So I'll explain a little bit why, later on in the presentation. But we do know that if the baby's brain cells don't get enough folate into them, then their brain will not function normally. Um, So later on in this video, I'll be talking about how pregnant moms or women who are planning to become pregnant need certain prenatal vitamin supplements. So to make things easy, I've pre-selected the ones that work and put them in my online supplement store located on my website at drtaketa-wong.com. And the names of those specific supplements will be listed on the post as soon as this Facebook live presentation is over. I have a brother with autism, and he was my inspiration, also my motivation for making the treatment of autism my work and my passion. I've worked with hundreds of families and sat with parents as they talk about the stress of raising a child with autism, their worry that they are not doing enough or they're not doing it right, their stark fears about their child's safety when they bolt into the street ignoring oncoming cars. And that can be terrifying for families that are dealing with autism. I've also sat with families as they beam with pride at their child's latest accomplishments and express their gratitude for finding a doctor who knows how to help them get better. So, without question, children older than 4 can get better and they can live a happy and productive life. Without question, um, you know, again, these children can get better. I've seen it. Um, And it's just that it's rare that a child will completely recover from autism. I have seen it. However, I would say that it's rare that a child will completely recover. However, again, many children improve significantly. And my brother is a great example. He lives at home, he's doing well, um, and he's happy, he has a job, he's overcome so much. Um, because the studies are so striking, because I've seen the results in my own clinic, I decided to do this presentation to let people know that folate can reduce the risk of autism in an unborn baby, and in children under 4, folate can sometimes reverse a child's autism altogether. So again, with a proper medical and behavioral approach, autism is treatable. And that's something that's really important that I want everyone to know, that autism really is treatable, because that's something that, in my mind, is really just so important. Um, there are so many families who really don't think that autism is treatable. And it's just important to know that it actually is. Um, so just wanted to really make that clear, to everybody that, it is something that is treatable. So how is this possible? We don't have all the answers, but in general, we know that autism is caused by a combination of genetic and environmental factors. Environmental factors include air and water pollution, as well as pesticides from foods and juices and household chemicals. Genetic factors include certain genes that are associated with a higher risk of autism. So some of these genes affect the liver's ability to remove toxins from the body. Other genes impact brain chemicals having to do with language, um, also awareness, behavior, and social skills. There are still other genes that can affect the digestive system and the immune system, which can then in turn affect the brain. If the baby's brain cells don't get the right amount of nutrients, brain development can be thrown off. One of the most significant nutrients for the baby's developing brain is vitamin B9. This is a vitamin which is essential for proper brain function. The baby needs to have it in order to have normal brain development. Again, you'll find the best prenatal supplements with the right form of folate, which will be listed on our post once the video has concluded. So how does folate get into the brain? Like everything else in the body, it's regulated to make sure that the right amount of nutrients can enter our cells. In normal brain development, that happens. The brain cells are able to receive the folate. So what is different about autism and what's going on there? I'll get back to the great news about autism treatment in a moment, but before we go on, I wanted to pause to remind those who are just joining us that we offer a no-charge phone consultation so that you can talk with me personally about any health concerns that you have and about how to feel empowered with your health. Arranging a consultation, again, is very easy. Just call our office at 808-425-2987 and let our staff know that you're interested in a no-charge phone consultation. Or you can also text free consult to that number. You can also click on the contact button on our Facebook page, and either way, our staff will contact you to arrange a no-charge phone consultation. You'll find all of our contact information right here on our Facebook page. 75% of children with autism are making something called folate receptor antibodies, which is a type of protein, and these antibodies are not allowing the brain cells to receive the folate. So they're like the linemen on a football team. They prevent the person with the ball from getting through the line. So in this case, the antibodies, which are like the linemen, are preventing folate from getting into the brain cells. This is where the science comes in and why it's so important to know what form of folate a mom is getting. I think most moms have already heard about the importance of folate during pregnancy, and that's why folate, or a specific form called folic acid, is added to all kinds of packaged foods. The problem is there are different forms of vitamin B9 or folate. There is folic acid, there's also folinic acid, and there's methylfolate. Folinic acid and methylfolate are the right forms of folate that can be used in the baby's brain. In that form, the baby's developing brain can receive it. However, the most common form is folic acid, which is synthetic. It's an artificial form that is made in a laboratory that does not exist in nature. So that is the kind that is in supplements or on most drugstore shelves, and the kind that's added to various types of food products. So why is that important? Let's get back to the antibodies. If the baby has these antibodies, the folate, which is in the form of folic acid, can't get into the brain cells. It doesn't matter how much is taken. If that form, synthetic form, folic acid is taken, then it doesn't matter that the ball can't get through the line. The folic acid can't get into the brain cell. The two forms that can get the ball through the line are folinic acid and methylfolate, but not folic acid. These two forms, folinic acid and methylfolate, will get into the baby's brain and will help with normal brain development. The baby's brain can receive those forms. You'll find the best prenatal supplements with the right form of folate, again, will be listed on our post once the video has concluded. Again, we know that if the baby's brain cells don't get folate into them, then the brain will not develop normally. So what does that mean and how does that look in real life? It means delayed development, and it also means an increased risk of seizures. So at an age when the baby is supposed to be babbling and babbling turns into words, that doesn't happen. What we see is that the baby doesn't attempt to imitate sounds and words as normal babies do. They might scream or cry or make noises, but they never babble or develop words, or there may be a noticeable delay in that development. As the baby becomes a toddler and beyond, it means that there can be problems with language. There can be a lot of tantrums, meltdowns, difficulty with social interaction. It can lead to diminished overall cognitive function in general, like a lack of awareness about what's around them. And it can also look like no concept of danger with things like traffic or high places. And I do like to say that just because a child is high functioning, it doesn't necessarily mean that they don't have problems with the folate receptor antibodies. they can have problems with those. So that is something. So I have seen a number of individuals who are high functioning, um, who, you know, they're high functioning, they don't have tantrums or some of these really dramatic types of behavioral problems. However, we do notice that they have a delay in language, they have problems with social skills, other kinds of things that are problematic. Um, so, in a research study of 25 children with autism, 19 had folate receptor antibodies. Those children were treated with high doses of folinic acid. They also had dairy products removed from their diet, which will be a topic of a later Facebook Live event. Of those children, two of them, the youngest children, who are ages 2 and 3, actually recovered from autism completely, which is amazing, right? I mean, that's totally incredible. All the rest of the children who are older, they didn't recover from autism completely. However, they did see significant improvement. And the children who are cured went on to develop and look completely normal. Um, so, what does this mean? This means that, again, folate is critically important in the development of brain function. It also means that many children with autism have problems with this. So, what to do? If you are pregnant or planning to become pregnant, make sure to eat plenty of leafy green vegetables. Also, make sure to take a prenatal vitamin supplement that has the right form of folate, either folinic acid or methylfolate. It could also be folate that is derived from whole foods. That way, even if the baby does have folate receptor antibodies, their brain can still receive the folate. Man-made folic acid will not be received by the baby's brain cells. To make it easy, I've pre-selected prenatal vitamin supplements with the right form of folate just for pregnant moms or women who are planning to become pregnant. You can find them on my online supplement store on my website at drtaketa-wong.com, so drtaketa-wong.com. The names will be listed on this post as soon as the video is finished. So, what have we covered today? We have learned that the symptoms of autism can many times be avoided if the baby's brain gets enough of the proper form of folate during pregnancy, and that for some children age 4 and under, their autism can actually be reversed by giving them the proper form of folate. It's important to remember that any treatment should be based on laboratory testing and should be under the supervision, I would say, of a qualified and well-trained doctor who is trained in the proper use of using folate to treat folate receptor antibodies. If you would like to arrange a personal health strategy session or phone consultation for people interested in talking with me one-on-one, there's absolutely no charge. Just call our office at 808-425-2987 or text free consult to that number. You can also click on the contact button on our Facebook page. Either way, our staff will contact you to arrange a no-charge phone consultation. You'll find all of the contact information right here on our Facebook page. So again, mahalo, thank you for joining us, and aloha. See you in 2 weeks. Bye-bye.